I'm Kate Milliken, and welcome back to the ECTRIMS conference and the Daily Minute. The topic of CCSVI burst onto the scene 2 years ago, and it has received a lot of attention. Dr. Robert Fox gives us some insight into some recent findings.
The CCSVI theory actually dates back over 100 years. Very soon after multiple sclerosis was diagnosed, its association with blood vessels was recognized. In the last few years, this idea has come back again, and mostly through an ultrasound assessment. One of the confusing aspects of CCSVI in the last couple years is the very different results that have come from different studies. Some showing that there was an association with MS, and others showing that there was not an association with MS. The 100 to 0% has to suggest that the way the test is being done is different. The way one group is doing it and getting 100% is vastly different from the way another group is doing it and getting 0%. We need to better standardize how the ultrasound assessment is done across all sites. My ultrasound colleagues and other ultrasound colleagues that are funded by the US and Canadian MS societies all got together in September of 2011 for a consensus conference. And we put together our ideas as to how to best standardize ultrasound so that the way it's being done at each institution, it's all the same. Another area that we have been curious about with CCSVI is the effect of hydration. Many MS patients have neurogenic bladders, or bladders that don't quite work so well. And instead of having to go off to the bathroom all the time or very frequently, what MS patients will frequently do is to just drink less fluids, to be a little bit dehydrated so that they don't have to go off to the bathroom so often. Well, that dehydration may be connected to the CCSVI observations on ultrasound. So we're in the midst of performing a formal evaluation of hydration, looking at dehydrated patients, applying ultrasound, and then rehydrating them and looking at the ultrasound again to see how much does the CCSVI ultrasound assessment change when going from dehydrated to rehydrated. One area that has been lacking in the CCSVI studies have been evaluation of the actual tissues that are involved. So we have been performing a study looking at autopsy, where in 7 MS patients, there were 9 abnormalities within the neck and chest veins. And in 6 healthy controls, there were only 2 abnormalities. So this was surprising to us in that we found a number of abnormalities that may have hemodynamic or blood flow significance in MS patients that seem not to be so common in the non-MS controls. There have been several positives that I think have come out of the CCSVI question. Some is the engagement of MS patients with investigators, with researchers, and really pulling them closer and getting them on the same page with each other. A big positive outcome from the CCSVI is a focus on progressive MS. And the CCSVI story has really brought into the center focus of what are we doing about progressive MS? We don't have effective therapies, and we need to work on figuring that out. We will be seeing at this meeting many different studies looking at CCSVI. Some will be reporting an association with CCSVI, some will be reporting no association with CCSVI. And what's important about these conflicting studies is that there is ongoing focus. Is there a true association or is there not?
Tomorrow, we'll focus on environmental risk factors, things around us that might be influencing MS. We'll see you then.